Today's drug is Oxycodone, brand names Oxycontin, Roxicodone, Xtampza ER, and Oxycodone. The pharmacologic and therapeutic class is an opioid analgesic. Dosage form and strength. The medication comes as a capsule in a 5 mg strength. It also comes as an extended release capsule going by the brand name of Xtampza, which is an abuse deterrent 12-hour formulation. It comes in a 9 mg, 13.5 mg, 18 mg, 27 mg, and 36 mg strength. There is also the concentrated solution that comes in a 100 mg per 5 milliliter concentration, as well as a regular solution that comes in a 5 mg per 5 milliliter concentration. There are also immediate release tablets that come in a 5 mg, 10 mg, 15 mg, 20 mg, and 30 mg strength. There are also extended release tablets that go by the brand name of Oxycontin extended release. These are abuse deterrent 12-hour formulations. It comes in a 10 mg, 15 mg, 20 mg, 30 mg, 40 mg, 60 mg, and 80 mg strength. Indications and dosing for adults. The first indication is for moderate to severe pain. A few quick notes. The first being to use the lowest effective dose used for the shortest effective duration. The next note is do not taper the dose greater than 10 to 25% every 2 to 4 weeks if discontinuing long-term usage. The first category for moderate to severe pain treatment are the opioid-naïve patients. The dosing is based on the individual, and it is given every 4 to 6 hours as needed. The initiation dose is between 5 and 15 milligrams by mouth every 4 to 6 hours as needed. The next category is for the opioid-experienced patients. This is also based on the individual and given every 4 to 6 hours as needed. The initiation dose is based on an appropriate conversion, and it is based on the patient's current opioid intake. The next indication in adults is for severe chronic pain. There are several notes here as well, the first being to use the lowest effective dose used for the shortest duration that is effective. The next note is to not taper the dose by greater than 10 to 25% every 2 to 4 weeks if discontinuing the patient off long-term usage. And the last note is you can increase the total daily dose by 25 to 50% every 1 to 2 days. In severe chronic pain, the first category is for opioid-naïve patients. This is based on the individual. The extended release formulation is given every 12 hours and initiated at 10 milligrams by mouth every 12 hours. For opioid-tolerant patients, this is also based on the individual. The extended release formulation is given every 12 hours. And here, the initiation dose is also based on an appropriate conversion, and it is going off of the patient's current opioid intake. Indications and dosing for pediatrics. The main indication in pediatrics is for severe chronic pain. This is approved only for ages 11 years old and above. The extended release dosing is individualized and dosed every 12 hours. You may increase the daily dose by 25% every 1 to 2 days, and use the lowest effective dose with the shortest effective duration. An off-label use in pediatrics is for moderate to severe pain. The dosing range is between 0.05 and 0.15 milligrams per kilogram per dose taken by mouth every 4 to 6 hours as needed, up to a max of 5 milligrams per dose. For opioid-naïve patients, use the lowest effective dose with the shortest effective duration. Mechanism of action and pharmacology. The mechanism of action is oxycodone inhibits the ascending pain pathway by binding to the opioid receptor in the central nervous system. This depresses the CNS and alters the response and perception of pain. The medication is hepatically metabolized via the CYP3A4 and CYP2D6 pathways. It is excreted through the urine. The onset of action for pain relief for the immediate release formulation is around 10 to 15 minutes with a peak effect around 0.5 and 1 hour. The time to peak for the immediate release formulation is between 1.2 and 1.9 hours, with the extended release formulation between 4 to 5 hours. The duration of action for the immediate release formulation is around 3 to 6 hours, with the extended release formulation around 12 hours or less. The immediate release half-life elimination is between 3.2 and 4 hours, with the extended release tablets around 4.5 hours, and the extended release capsules around 5.6 hours. In children between 2 to 10 years of age, the average elimination is around 1.8 hours. In adults, it is around 3.7 hours. Oxycodone is between 38 and 45% protein bound. Special populations and considerations. For the renally impaired, there is a higher AUC in patients with a creatinine clearance less than 60 milliliters per minute and an increased half-life elimination around 1 hour. In the hepatically impaired, the AUC with half-life elimination increases to about 2.3 hours. In elderly, the initiation dosing should be started at the lowest end of the dosing range. Regarding pregnancy, the drug may be associated with birth defects, poor fetal growth, and stillbirth. In regards to lactation, consider an alternative due to the risk of infant CNS and respiratory depression. Oxycodone is contraindicated if an MAOI is used within 14 days, as well as in GI obstruction and in coma or impaired consciousness. Exercise caution if CNS depression, alcohol use, head injury, a seizure disorder, or cardiovascular disease. Side effects. Some common side effects are constipation, dizziness, vomiting, fever, anxiety, and confusion. Some serious side effects are abuse, dependency, adrenal insufficiency, seizures, cardiac arrest, and respiratory depression. There are multiple black box warnings for oxycodone. The first is for addiction, abuse, and misuse. The second is for opioid REMS. The third is for respiratory depression. The fourth is for accidental ingestion. The fifth is for neonatal opioid withdrawal syndrome. The sixth is for CYP P450-3A4 interactions. The seventh is for hepatotoxicity. And the eighth is for risks from use with benzodiazepines and other CNS depressants. Drug interactions. Some considerations for drug interactions is the medication is a CYP2D6 and 3A4 substrate. It has anticholinergic-like effects. Exercise caution if CNS depression, delays in gastric emptying, hyponatremia, serotonergic effects, and opioid agonists. Some contraindicated drugs and drugs of note. The medication is contraindicated with naltrexone. Avoid and exercise caution with amiodarone, amlodipine, clonazepam, codeine, paroxetine, as well as others. Monitoring parameters. Monitor the level of pain relief, respiratory status, mental status, blood pressure, bowel function, signs and symptoms of abuse, misuse, and addiction, as well as hypogonadism and hypoadrenalism. Patient counseling information. Oxycodone is used to relieve moderate to severe pain. It may be taken with or without food. If nausea is experienced, then take it with food. Avoid eating grapefruit or grapefruit juice, which may increase side effects experienced from oxycodone. Suddenly stopping the medication may cause withdrawal after long-term use or after the usage of high doses.